Hi, I'm Laura McCarthy from LB Hand Therapy, and we're here today to talk about thumb stability exercises. Oftentimes we prescribe thumb stability exercises for our patients that have arthritis in their thumbs. This is done after the thumb is less painful and the swelling has gone down. We usually use putty to do the exercises. The first thing is getting the putty out of the container with your sore thumb. You take the lid off, and then most people have trouble pulling it out. So what we do is we squeeze the putty container from the sides, which pulls the putty away from the edge, and it makes it easy to get out of the container. Now the first exercise we prescribe is just squeezing the putty with your hand. This improves grip strength or finger strength, which helps compensate for the thumb. The next exercise we do is thumb adduction. So you start with your hand flat on the table, palm up. You put the putty between the thumb and the index finger, and you pull in towards the index finger. The next exercise we do is thumb abduction. You pull the putty apart. You start in the same position, palm up, hand flat on the table. You put the putty right at this joint of the thumb, and you push up towards the ceiling. You keep the hand flat on the table, you don't let it roll. People often ask me, how do you do that? Because you have to reach so far. So we pull it in closer to them. As long as you keep the same posture with the hand flat on the table and the thumb in, it becomes easier to do right in front of you. The next exercise is thumb flexion, and you bend through the putty like this. If this causes grinding here, another way to do it is to curl your fingers into a tight fist and bend. You want to make sure there's a bend here and a bend here as you pinch. The last exercise is the three-point pinch, which is for stabilizing the thumb and practicing that stability. You use your index and long finger and your thumb, and you squeeze the putty between the three. You try to keep a circle here with a little bend here and a little bend there as you squeeze in. The critical thing is to keep the circle as you bend in. We usually prescribe about 10 repetitions of each of these exercises once a day and progressing slowly from there. Thank you for watching this video. I hope you found it helpful. If you need further information, please check our website, lbhandtherapy.com. And again, thank you for watching.